All right, for those of you who are just now joining in, I welcome you to CarePortal, to Golden Rule Software. And I've got here in front of us an agenda that we're going to attempt to cover in the next couple of hours. So the first item that I want to get out of the way is if you see on the right-hand side of your screen, if you see the GoToMeeting panel covering up part of your screen, you're welcome to click on the little white arrow within the orange or reddish background that will collapse it over to the side. Also, if you'd like to ask questions as you go along, there's a chat window down at the bottom, and I will be glad to answer those later on in the session after I've covered the basic flow of the session. And I have everybody on mute, so again, I will be paying better attention than to the chat windows. That if anybody has any technical difficulties, please feel free to put those questions in the chat window on the right-hand side of your screen. All right, so first off, CarePortal, as you know, is a web-based system, and all it requires is in the back office is Internet Explorer 8 or 9. You have to have Windows XP or higher, which includes Vista and Windows 7. There's also a new operating system, Windows 8, coming out, and it's mostly compatible. If you have a Windows 8 device, just let us know, and there are a couple things that we need to work out with that, but it's a very new product. Other than that, if you're using a point-of-care device, we support the iPad and the iPod, as well as a number of the Android devices. Although there are so many flavors of Android, we can't guarantee that they're all supported. You might want to contact us before you buy a whole large number of Android devices. The only other thing you need on your system is an Adobe Acrobat Reader, which is available to most users already on their machines. All right, so when we start working with you, or when you start to go live, we'll give you a link or an address that you can use. And in this case, this is my address at the top here, but we'll provide a customer-specific address. Now, if you'd like, you can go ahead and once you bring that address up and the login page comes up, you'll want to go ahead and right-click somewhere on the page and say Create Shortcut and say yes, and that will put your shortcut on your desktop. I already have one, so I'm not going to go ahead and do that, but you get the idea. All right, so we'll also provide you an administrative user account that you can use to log in for the first user. And I'm going to log in myself as Ken. All right, and so when I log in, I see my 6 modules, and today our primary focus, as indicated by this agenda, is going to be the administrative module. We're going to get everything up and working so that you can start using the clinical system to add your visits and your assessments and so forth, and to do your billing. All right, so I'm going to go ahead and click on the admin, and as you can see in the general section, there's workers, users, and agencies. We're going to focus on those first. So what you want to do is you want to go into agencies, and we're going to already provide you an agency, and you'll want to just click on that. And the agency information may not be up to date for you, so you're going to want to go through the list and change the name of the agency to meet your needs, the agency code, the start of the work week. If it's a Sunday or if it's a Monday, you can change that, and that will cause your calendars to reflect whatever day you choose. Your supply cost markup, if it's the the retail versus what you actually pay for it. If it's a 2-to-1 markup, that's what you would put in, or if it's 3-to-1 or what have you. You can also put in your tax ID, your home health intermediary. If it's NGS or Palmetto, you would choose that option. You'd put in your address and so forth. Basically, everything that has an asterisk next to it is required. Medicare provider number. If it has a checkbox next to it with an NA, you can check that, and that will make it so that it's not actually required, but it knows that you knew it's not required. All right, so the state assigned ID number is critical if you want to be able to submit your OASIS assessments to the state. You put in your contact person and so forth. Now, you can put in regional offices for a given agency, and we'll cover that with you if you have that need, but I don't want to take everybody's time for those who don't have regional offices that they need to put in. All right, so that covers the agency information. And I recommend that you don't add a new agency, just use the one that's already there. If you have the need to add more than one agency, you'll need to contact us, and we'll work through the options with you there. All right, so that's workers. Let's go ahead and add, or sorry, agencies. Let's go ahead and do a worker now. We're going to add a new worker. And we're going to say Johnny worker, and unknown here for SSN. If I want, if I see that it's required, I can go ahead and choose unknown, and let's choose male. All of the rest of this information is optional. If I want, I can put in a zip code like 75146, and then choose that, and it puts the information into the system. And it's a 123 Main Street. You can also put in a cell phone number, 469-693-5608. And if I put in a provider, a cell phone provider, then that means a text message can then come to me if I get assigned visits for particular patients. If the start of care is assigned to me, then I will receive notification on my cell phone as a text message. You do also, if you want to do that, you have to choose a cellular provider. In my case, it's Virgin Mobile. All right, and an email address is also required, and the reason we do this is because it will support the ability to do electronic signatures, which is required for that purpose. ken@goldenrulsoftware.com, and let's choose, well, the office is the primary office the worker is associated with. If it's a branch office, you could do that. Otherwise, just choose the parent office, the parent agency. You can do departments and teams. If you have, if that's a very optional thing, but if you have a large agency that has various geographical departments or operational departments, you can assign those as well. All right. Normally, a worker cannot be assigned visits for patients at the same time, for two different patients whose visits overlap. But if you have a particular worker, like a contract agency, PT contract agency that you put in as a generic name, and you want them to be able to overlap in terms of the visits that are being assigned to them, you can check this checkbox to exempt you from that check. All right, so I'm going to choose another requirement here is the primary discipline. If it's not a clinician worker, then you still have to put in a discipline, and that's going to be administrative. And in general, that's the best way to do that. But in this case, I'm going to assign skilled nursing to myself. And normally, if you don't put anything in the clinician title, it's going to use the discipline as the title for the worker. So it would be Johnny Worker, comma SN. That's not a very appropriate title. So if I want to override that, I can choose RN. But if it's a PT, then it's appropriate just to leave it as the discipline because PT is both the discipline and the title. All right, so I'm going to go ahead and save that. And once I save that, then some more options become available for me here. If I want to add secondary disciplines, for example, if this particular clinician was authorized to go ahead and do HHA visits, home health aid visits, you could assign that as a secondary discipline. But you won't be able to schedule any visits to a worker if their discipline is not either in the primary or secondary discipline list. Okay, so I'm going to cancel that. Let's go ahead and take us now to the worker skills and training. If you're involved in HR, you're going to want to be able to put in, things like when the driver's license is coming due to be renewed, or CPR, or green card. Any number of other items are available on this list. And if you don't find what you're looking for on this list, there is a way that you can add additional items to that master list. So let's say the effective date is 12/20, but we know that the driver's license is going to expire in 2013, 12/20/2013. And you can either put the date in that way, or you can put it in through the calendar picker here. Right, and so that way you'll be able to receive notifications when the, like within 30 days of when the training or skill is coming due. Right, so I save that, and I've got my driver's license skill. I can click New Entry and add as many of those as I wish for that particular worker. In addition, before we leave the worker, let's go ahead and go to worker status history maintenance. This is something you would do primarily if a worker is going on leave or if they're being terminated, so that you don't end up, or maybe even if they're on vacation, you could exclude them from being assigned any visits during that period of time. So if you put in new entry, you put in the the type of, maybe it's a leave of absence, and you would put in the date, and then later on you could put them in as an active worker again, so that now they're able to be assigned visits again, starting from that point in time. Okay, so I'm going to click back. That takes us back to our worker again, and so I think we're pretty much done with looking at the worker. All right, so we've done agencies, we've done workers. The next item in our list is users. Now, I just want to say a word about users in CarePortal, the distinction between a worker and a user. And a lot of people's minds, that's the same thing, but the distinction in CarePortal is that a worker is just somebody who can do visits, but they don't necessarily log into the system. We created the concept of a user as opposed to a worker so that you could have certain workers who don't log into the system. They're just, maybe they're home health aides or what have you that never log in. So you just put them in as a worker but not a user. Or, for example, if you had a physician that you added to the system that you wanted to be able to access the system, you would put in the physician and then you would put in the worker, the user, and link that user to the physician. So that's why we have that distinction between the user and the worker. So in order to add a user, you simply click on users, and then let's go ahead and click add new. And I recommend for the username that you put in first initial of their first name, and let's say J worker. And then you would link that user with whatever worker or physician that you had in the system that you wanted to link it with. So in this case, it's going to be Johnny worker. So as I type in here, then it zeroes in on it, and I select that. You also want to choose digital certificates for electronic signatures because most of you probably want to be able to sign your documents electronically. I just recommend doing that across the board so it's ready when you need it. We can discuss later the drug interaction license key. We have a third-party tool that allows you the convenience of determining drug interactions, but it is something that is licensed to a third-party product, and so we need to keep track of how many people are using the system so that those charges can be passed on accordingly. And those details will need to be worked out with Randy. So if you're interested in that feature, then just let us know and we'll work that out for you and put the license key in for those users, depending on how many licenses you applied for. All right, so as soon as you click Save, that's going to send off a temporary password to this worker, and I'll get to that in just a second. But that was step one of adding a user. Step two, there's basically 3 steps. Step one is add the user. Then you're going to want to put in the office information. Down here, the user, agency, and office assignment. So which offices does this particular user get to have access to? So I'm going to click New Entry, and I'm going to choose, I can either choose this branch office or the parent agency, or both. So I'm going to go ahead and choose the parent agency and save. Okay, so now I've got step 2 done. I've put step 1 in, create the user. Step 2, which offices or office does this user have access to? And for that particular office, what are the roles that that particular user gets to have? Now, roles are things like, well, what areas of functionality, billing, scheduling, reporting, various types of things like that. What things do they get to have access to? So I'm going to click on this help bubble here. This you can refer to later on, and actually have that up somewhere else here. Apologize. Okay, so this came up, and it allows me to click on a link to see more detail about what the different roles are available to me to assign to my users. We've got back office, point of care, scheduler, billing specialist, reporting, and all forms with workers users, and also the CarePortal Super. There are various other roles, but these are the primary ones that you're going to want to be able to use. The first item that, or the most basic role that you would assign is either back office or point of care. For all of your users, you're going to need to start with either back office or point of care. Now, it is possible to assign both back office and point of care to any given user, but I don't recommend that on a normal basis unless you have a clinician who's doing visits, and who's also working in the back office regularly with other patients or other workers and their patients. All right, so if you're in point of care, you're typically working only with your own patients. If you're in back office, you're working not only with maybe your own patients, but other people's patients as well. So you start with either back office or point of care, and then you can add other roles on top of that. So let's go ahead and do that. Let's put in a starting role as back office. That basically gives me all of the clinical functionality in the back office mode. It doesn't give me administrative, it doesn't give me reporting, doesn't give me scheduling, doesn't give me billing. All right? If I want to add any of those roles, I can stack them up on top of each other. I can put in scheduler, I can put in reporting, I can put in billing and so forth. Now, if I want to do a shortcut and not do any of that, I can put CarePortal Super. That's what I'm going to go ahead and do, and that gives me basically everything. So if I put back office and Super, that's the whole ball of wax. Nothing else is needed. All right. But if you wanted to limit them to do only certain things, maybe, for example, maybe you wanted to give them back office plus anything administrative related, but not the workers and users. So you don't want them to deal with HR. You just want to be able to, have them put in physicians and, maybe some payer information and so forth. But you wouldn't want them to be able to access the workers and the users' permissions and things like that. And again, all that's available in the help mode if you'd like. Okay, so those are the 3 steps. You put in the user, link them with the worker. The step number 2 is assign which agencies and offices they have access to, and then for those agencies and offices, you would put in what roles they have. All right? So if I did everything correctly, I should have received an email in my inbox because I assigned that worker to my email address. I'm going to go ahead and check my email on the side here on another window. And I did. I got a temporary password, so I'm going to log out. I had signed in as Ken earlier. Now I'm going to type in, J worker, and the temporary password that came to my email address is 514911. So that let me in, but it now forces me to change my password. I have to verify my information is correct because that's the information that's associated with my electronic signature. And I'm typing a new password. It just has to have 6 characters or more. And you have to check this checkbox to say you understand this is securely encrypted and it's going to be used for signatures. Nobody else should have that. All right, so that let me in. And now that that operation is complete, I've added my worker, my user, and I'm in. All right, so I'm in as a back office user at this point. Now let's go ahead and review what we've got for our training session agenda. We've gotten down to this part. We've added a user. I'm going to review the charge rates. Okay, so if I go into admin, let's take a look at the charge rates here. I can just review. These are going to be pre-delivered to you, and if there's particular disciplines or charge rates that are not in here and you need to either add or change them, you can do that by clicking add new, or you can go in and edit this. Maybe skilled nursing is not 200, maybe it's 225 per visit. And you could also put in a start date and an end date so that if the charge rate changes from one year to the next, you can put the start and end date and put a new rate in so that it picks that up for your claims after that point. Now these are the default charge rates, so you can also assign charge rates to particular payers. But if you don't put charge rates in for those payers, then these default charge rates are the ones that are going to be used. So that just helps you. So if you have a number of payers and you're using the same charge rates and codes for all of those, then you would just put this in once, and then they would apply to all of those. But you could override that for each individual payer if you like, and I'll show you how to do that. Okay. All right, so those are the charge rates. Let's take a look at the Medicare master payer. When we set up your system, you will already have a master payer called Medicare, and you'll see it as Medicare-PPS. If you click on that, I recommend not creating a new master payer called Medicare PPS, but just going in, clicking on it, and going down the line and reviewing the information that's in there. The main things that you're going to want to change, you're going to leave this alone. The billing calendar cycle has to be, chosen from this list. It's going to be either monthly or quarterly, custom date range. But for Medicare, it's always going to be PPS. You're going to leave the electronic, institutional. That if you do print the claims, it would show up on the Medicare PPS UB92 format, although that will be that's automatically recognized as UB04 because it's we're well into the past 2004 now, so it'll automatically convert 92 to 04. The main things you're going to want to change, review, and change in here are the sender code, sender ID, submitter identifier, and these are basically all going to be all three of these are typically going to be the same for Medicare. You will also want to put in your, whether it's your NGS or Palmetto or whatever your MAC is, Cigna. Put in the password that you normally use to connect, to transmit, or to submit your electronic claim files. Because CarePortal does allow you to submit directly to Medicare without having to do, to download the files or upload them through a third-party product. All right. So I would recommend leaving everything else the way it is, but it's mainly your submitter ID and sender codes that are going to change these three values here. Okay, there's a lot of other options I'm not going to go into right now. Save back. Notice that at the bottom of that, and I just kind of skipped over that. Let me just quickly recapture that. If I go down to the bottom, there was a link that said payer discipline rate and CPT-4 overrides. So if I did need to put in a different charge rate from what was originally defined in the screen that I showed you first, you could come here and you could click new entry and you could say, well, what is the discipline? What is the CPT-4 code? What is the modifier code, and so forth, that you can use to specify what is going to go to that payer. For Medicare, this is not necessary because the rates are already in the CPT-4 and the fixed codes are all predefined for you. Okay. All right, so let's go ahead and take a look at the, we've done the charge rates, Medicare. We're going to add a physician, Brad Aaron. And that's what we were doing, I think, when we realized that not everybody was able to see the screens. Let's go ahead and go into physicians. In the general group, it is a physicians tab. I already added Brad Aaron. Now this is an opportunity for me to perhaps show you how to delete an item, because I'm going to go ahead and reuse this position. So if I go into it, there's a delete button at the top, and I can click that, and it's going to say, are you sure? I'm going to say OK. So I've got a position there that I put in the previous session, and I'm going to go ahead and re-add that position to show you how that works. So I'm going to click Add New. And the position name is going to be Brad Aaron. And I can also put in a title if I want. And the other information that's optional. Now the national provider number is the next item that is required. So I'm going to click on that link so I can look up his NPI. So that's going to bring up the NPI registry. I'm going to search for an individual provider. And maybe it's Brad Aaron. And I can probably put in a security code, 34F46, and search for that. All right, so at this point, I'm going to go ahead and grab the NPI number. Here it is, NPI. If I double-click on that, and then I right-click and click Copy, and then I can go ahead and right-click in here and click Paste. And that takes care of my NPI for me. Most of the rest of this is optional. I will go ahead and put in a city-state zip. So you just put in whatever that might be. And one thing I'm going to mention is that you cannot put two physicians in with the two different physician records in with the same NPI. That helps prevent duplicates from being introduced into the system. unintentionally. If you do need to create a second office location for that physician, you might put in the first office here, and then you can save that, and office phone. Notice as I type this in, it fills in the dashes for me automatically, so you don't want to put in the dashes there at the same time. All right, and then once I've saved that primary physician or that primary physician location, I can also put in new entry and say, okay, here's my second location, and I can put in the address and so forth. And then that uses the same physician name and NPI and so forth for that physician, but the address and location is different. All right. Okay, so disciplines. We've done the physician. Let me just go ahead and take a look at the disciplines here. And we pre-deliver a list of disciplines that are most commonly used, but you can also add custom disciplines. For example, some payers like CareCentrix are going to want to keep track of different visits, like the first start of care SN visit, the SN admission visit is going to be paid at a different rate. So you can put in different charge rates and so forth for different disciplines if you want. And so you click on at the top here, Add New. You might put in like SN ADM for SN Admin. Put in description. You also link that to a regular category like skilled nursing, and you can put in a revenue code and so forth to go along with that. These can also be specified. The actual codes can be specified on a payer-by-payer basis as well. But you first need to put it into the main discipline list in order to be able to do that. All right, so that's the disciplines. General lookups. I mentioned just a few minutes ago the worker skills. For example, if you had in the worker skills list, if there was a particular skill that was not already in the list that we pre-deliver to you, you can go into this general lookups. Notice how we've got all of these different categories. You can put in teams, referral contacts, safety measures. I'm not going to take the time to go into all of these. Most of these are pretty self-explanatory. These are basically libraries that you can modify or maintain on your own. But there are a number of other smaller lookup categories that just didn't make it onto this list because there's too many of them. And so we threw into a general grab bag of general lookups. So if you know what you're looking for example, worker skills, you can go to general lookups, and there's just a whole lot of different things, body locations, bill payment status type, contact types, all kinds of things available here that you can explore. But if you know what you're looking for, like skills, for example, you can type in skill and click and enter, and that brings up worker skill automatically for you. So here's my 90-day evaluation, Alzheimer's training, automobile insurance, all those types of things. If you want, you can click new entry and put in whatever description that you want for that particular training skill. You can see there's quite a few here that have already been added for you, but again, you can add to that list. All right, let's go back to our list here, and we've got supplies. We're going to pre-deliver a set of supplies to you, but you can maintain this list and add new items to it. You can click Add New, and you can put in, description, cost, per box or per case. What is the agency cost? If you have a supply markup of 2 to 1, then if you put in, $5 here for your agency cost, well, then the charge rate will be $10 because it's doubling. And you would want to put supply as billable if you want to actually bill that supply. You can also put in a HCPCS code and a HCPCS modifier that will, if you bill supplies in your commercial insurance, you probably want to go ahead and put a HCPCS code in for it. Okay, so service journal transaction codes is the next item on the list. So let's go back. By the way, I do recommend using the back button rather than the back arrow on the browser. Just everything flows better when you use the built-in back navigation system that's built into your portal. All right, so what I was mentioning here is the transaction codes. This is also in the financial section. Transaction codes. These are used for payroll, and if you don't like these codes, you can add your own. And when you do the payroll export of all the visits and the services that are provided, there will be a code associated with each one. So, for example, if you pay an admission visit at 2 times the amount that you pay a routine visit, well, then you need to make sure that each of your visits are linked with the appropriate code. So if you click on AD, if you don't like this description, admission visit, you want to change that to something else, you're free to do that. You can change that to SOC, or something like that. And you can mark it by default as is billable or is payable. So those are the other options available. Now, we also have a point system that allows you to kind of keep track of the worker load. For example, if you have one clinician who's doing 5 start of care visits in a day, then they're going to have 5 times 2.5. That's going to be like 12.5 points for that day, and that's going to overload the worker. So you want to make sure that you're balancing your worker's load. And if you pay them 2.5 times more than you pay a routine visit, maybe an RV visit would be 1 point. So you can set those codes as you prefer. Right? There are some special ones that I don't recommend messing with, and that would be things like the documentation only. We do some special things with documentation only. So if you can put in an actual document as a visit note into the system and mark it as documentation only, it won't be paid for. Nothing will happen on a financial basis. But everything else you can play with as you wish. Okay, problems, goals, and interventions. I'm not going to spend a lot of time on this right now. We do have a predefined list of problems, goals, and interventions in this tab here. So you can see problems is really perhaps a little bit of a misnomer. It does include problems, but problems is basically a way for you to categorize your interventions and your goals. So if you have, for example, Alzheimer's disease as a problem, then you can put in particular goals, master goals for that particular problem, or interventions for that problem. And then these become available for your clinicians to pick from, so that when they choose Alzheimer's as a problem, then they're going to see these goals as valid options to choose from to build their care plan or their intervention goals for 45. Same thing for goals and interventions. Now, another trick that you could do that's optional is that for a particular problem, you could link that problem with specific diagnosis codes. So if a particular patient has, a diagnosis code of 428, congestive heart failure, then you would probably want to link your congestive heart failure problem to that particular diagnosis. So then what will happen is that when a particular patient has been assigned an ICD-9 code of 428, then when they get to the care plan area, the congestive heart failure problem is going to float to the top of the list, sort of to prompt the clinician to chart or to enter the intervention goals for congestive heart failure. Right? And you could do that by going into the diagnoses related to that problem. So if I go in here, I don't have any links for Alzheimer's disease between diagnoses and Alzheimer's, but I could put a new entry in and I could specify which particular diagnosis. All right, another trick that you can do, for example, what if you had a particular physician whose protocols are distinct to that physician? So you could put in, problem description of Dr. X's knee replacement protocol. Okay, so go ahead and click Save. Once I put that problem in, then I can put in my goals and say, he wants, or okay, play kickball. So Dr. X says one goal is for the patient to be able to play kickball, right? And then maybe an intervention would be take the patient to the gym. So that's an intervention that would be in the master list, so that if you have a patient who's been seen by Dr. X and who had knee replacement, you choose Dr. X's knee replacement as the protocol or as the problem, and then those interventions then show up automatically, and you can just select those as to put on your 485. Okay, so I think we've done enough for now on the administrative module. Most of the rest of these you can probably experiment on your own, but I just wanted to show you, some of the basic functionality that you need to get going with. All right, so I'm going to click Home, and that's going to take us back to our main logins, or our main welcome page. And so we're going to add a patient. We're going to add a Medicare patient. And in this first training session, I'm not going to show everything. I'm just going to limit myself to a Medicare patient because, in the interest of time. But we will have more sessions in the future where we get into the nitty-gritty of managed care and authorizations and various insurance. All right, so let's create a new patient, and we're going to call this patient Johnny Medicare. So remember, what I did was, just in case you forgot what I did, I logged in, I clicked on Clinical, and there was a button in the top right corner of my screen called New Patient, and that's what I clicked, and that brought me into the patient demographics. So I'm going to choose male, marital status, date of birth. Maybe I don't know the patient's race to start with, but so I can choose unknown, but this will become available to this part of care nurse as she goes through the assessment. Let's skip past all these optional questions that don't have an asterisk next to them. If I want, I can pull an address. If this is a husband and wife situation, or if there's multiple patients living in the same facility area, then you could put in the name of the facility, and that will pull the address in, so you don't have to retype that in. I'm going to put in 123 Main Street and put again 7546. All right, so on program, let's choose Medicare. Again, this list is one of the items that you can actually maintain on your own if you go into the general lookups in the admin area. If you don't like this list, you can get rid of items in this list and add your own items. They're just general categories of programs. I'm going to choose Medicare. Now, notice here this is the MRN, the Agency Assigned Patient ID. That's going to default to, depending on what you want. Right now, this one is defaulting to blank. But if you give us a number, let's say 10,000, you want to start at 10,000, we can set it to be 10,000, so it will default to 10,000. And then patient that you add thereafter will increment by one. For example, 10,001, 10,002, and so forth. You can put in the Medicare HIC number. I forgot, I think, to put in this Social Security number, so I'm going to scroll up and do that. All right, so let's scroll back down. Excuse me, take a little detour there. Case manager, let's say that the case manager is going to be Ken Daniels. And the rest of this information is optional. You can put in emergency care plan information. I'm going to put in a level of care of Class 1. Now, some agencies do require a triage or a level of care item to be chosen. And so we can set you up either way, and you can just let us know whether you want that to be required or not. This particular setup has a lot of different emergency contact or emergency preparedness information that you can put in. We can customize that to a certain extent for you. All right, it looks like I must have missed something here. I forgot to put in Medicaid ID. I'm going to choose NA because it's not a Medicaid ID, not a Medicaid patient. I'm going to go ahead and click Save again. Now, if it's saved successfully, then you'll see a previous button and a next button. So I'm going to click Next, which is going to take me to the next step in my intake sequence, which is to put in the physician. I'm going to put in a physician, and what was it, Aaron? Let's see if we can assign. There's Brad Aaron that we had put in. And I can go ahead and save that. If I want to add a secondary physician, I can click New Entry. And if I want to move them up and down, I would show all columns, and there's an up and a down. So I can, whatever is the top is the primary one at this point. Okay. So I'll click Next. And the next step is to put in the referral and intake information. So I'm going to click New Entry. Now, before I do this, I want to mention that CarePortal does not allow you to put in a patient more than once in the system. Just like, remember, with the physicians, you can't put the physician in more than once. If you have a patient with the same Social Security number and you try to put them in again, it's not going to let you do that because it wants you to have only one copy of the patient in the system at a time. Now, if the patient is discharged and readmitted, well, then the idea is you will come in and click New Entry here to create the second admission, the third, and so forth. Every time they're discharged, every time they're admitted and then discharged, you can then readmit them to the New Entry button. For the first admission, we also need to click New Entry. And by default, it's going to pick primary referral source as the physician that I assigned to this patient, the primary physician. And I can either type in my referral date or I can put it in, for example, 17th. Is the referral date. Maybe I want to do the same for my start of care date. The discipline of first visit, that's a mandatory selection that you have to make. If you have like a care-centric situation, you might want to choose the SN admin discipline to start with so that it gets linked to that particular discipline so it's billed properly. But for Medicare and a lot of other payers, just plain old SN would be sufficient. You can also assign a worker to that first visit, and I do recommend this. Let's assign this to Randy Drawn. What that's going to do is make sure that it shows up on the worker's calendar. And let's see, I'm going to go ahead and transfer from another. Okay, if you choose the transfer from another home health agency, then that's going to automatically cause the condition code 47 to show up on the claim for Medicare claims. So you don't have to put the condition code in. Notice also for this particular clinician medical record number, I had put in 1000 or 10,001 as my medical record number at the patient level. We're now in the admission level, and the first admission automatically gets the value of 01 tacked onto it. Now, if you discharge the patient and readmit the patient, then it'll be a 02, 03, etc. But you always want to keep the base MRN the same. You can put in, by way of documentation, you can put in the discipline services requested and other information that's optional. This does not actually drive your orders. This is just something that you can put in at the time of the intake if you know that information. And some of this, or a lot of this information will actually show up on your intake, your what we call our face sheet, which is like an intake form that you can print out. All right, if I click Save, then that's automatically going to assign that first visit to Randy Drawn, and it's going to create my first episode, and it's going to give me the opportunity to then do my start of care assessment. All right, so I'm just going to move on. If you had a marketer, for example, that you wanted to add as a secondary referral, in addition to the primary referral source, who's typically your physician, you could go into patient supplemental referral, and you could put in new entry, and then you could say, who was put in the date if you want, and then say what is the referral source. Maybe it's Johnny Worker. I think I misspelled Johnny. Okay, there it is. So then I go ahead and save that, and then there's reports that you can run to see who the marketers were who did the referrals. And you could reward them for it. All right, so let's go ahead and click Next. And this is the last screen on our intake sequence. Notice, I don't know if you heard, there was a little text message that came in on my phone, and that was the indication that I had been assigned that visit. Okay, so if we had put in, and we put in a Medicare ID in the patient demographics, so it automatically generated a payer policy with that HIC number for us. We don't need to actually put in anything further for this particular payer policy patient. If it had been non-Medicare, we would be required to put in a new entry here and say, okay, well, what is the payer that's assigned to that patient? Again, we'll get into more of this when we get into management. Now to go into details. Basically, our intake sequence is complete. If I click Next, it's going to take us to our main patient menu, or patient console, is what we call it. Notice there's some items here that are yellow, meaning that they have not yet been entered at this point. So that's just kind of a visual cue to you as to what needs to still be done. Eligibility, since I put a fake patient in, I'm not going to be able to check eligibility, but if it's a real patient, you would want to go ahead and do that, and that would turn the yellow from back to gray. All right, so now we've completed the intake sequence for Johnny Medicare. So I'm going to go home, and I'm going to sign out of the back office, and let's take a look and see where we're at here. We've done all the administrative tasks. We're in clinical. We entered a new Medicare patient named Johnny Medicare. I talked about the default patient ID. It could be like 10,000, 10,001. If you want, it can also be date-based. Like today's date is 12/20/2012, so it would be 2012, 12/20, and then whatever the hour and minutes are, 13/47, maybe even the seconds you could have thrown in there. So it would be a really long ID, but it would be guaranteed to be unique across your various offices. So those two options are available. Either it will be assigned incrementally, starting with a particular number, or it will be a date and time-based ID, or you can just have it be left blank, and it will be up to you to put it. Okay, so I entered the referral admission information and assigned to clinician Randy. Now I log down to the point of back office, and I'm going to log in now into point of care. So I'm going to log in as Randy. There it is. Okay. Also, when I log in, it's telling me you've been assigned a visit for patient Johnny Medicare. So I'm doubly aware of it. If I hadn't received it on my text message, I would be aware as soon as I log into CarePortal. All right, so let's go to my schedule. And we should see Johnny Medicare. There's a lot of color here. The red means that it's past due. And I did assign it for the 17th, and currently we're on the 20th, so that is in the past. So Johnny Medicare, I'm going to go ahead and click on that. Let's pretend I'm on my iPad now. So just to make sure everybody's clear, I've logged into the point of care. I'm no longer in the back office. I'm out in the field. I'm at the patient's home. And so I click on there, I tap on this Johnny Medicare visit. Okay, that takes me in, and it tells me start of care visit. And if we had wanted to, in the back office, we could have put in additional information. For example, beware of the dog, change the catheter, and so forth. And that would show up as let's go ahead, and because we know it's the start of care visit, we don't want to do a note. We want to do an assessment. All right, so it's going to give us the primary referring physician by default is going to be Brad Aaron. We just go ahead and accept that. If there's multiple physicians, you could choose which one it is from this list. But this patient only has one physician assigned to it. And it is an admission visit for my transaction. This is what's going to be used for payroll. Now, for the assessment name, we've got start of care, further visits plan. That is the default granddaddy of all assessments. It includes all the OASIS questions, all the 45 questions, and in addition, a fully comprehensive, integrated set of skilled nursing questions, including vitals, musculoskeletal, genitourinary, bowel sounds, respirations, all of that kind of stuff is going to be included along with it. Now, I recognize, though, that especially when you're first getting started, you're going to have a number of clinicians who are not ramped up or not on the devices yet. So you may want to do a more stripped-down version that doesn't include all that additional information. So we will also provide for you, if you wish, depending on your agency's policy, we'll provide one called 1-Start of Care OASIS. So we'll include all the OASIS and 45 information, but not any of the additional information. We're going to go ahead and choose the Start of Care, the full one right now, and see how quickly we can get through this. Notice here the requires supplies and claim. That checkbox is something you want to pay attention to, especially at the beginning of the episode. If you intend to bill supplies, non-routine supplies to Medicare, then you're going to want to check that checkbox because that's going to affect the HCPCS code the HIPS code that gets generated as a result of validating this assessment. So when it gets transmitted, it's going to have either a number or a letter at the end. And so you want to do that up front and make sure you know which it is. There is a backdoor way that you can change this after the fact, but it's recommended that you choose the correct value there to start with. So what you do to complete the assessment is you go into Next. We've barely just gotten started on this assessment. So it's going to choose, you can choose the homebound status. Most of you have probably seen this demonstration before. I'm going to go ahead and when I click Next, it automatically saves it for me, saves that value. So I don't have to click Save or anything every time. I just click Next, Next, Next. If I change my mind and I changed it from shortness of breath to considerable taxing effort, click Next, it'll save that again. And if I click Previous, then I can come up here and I can select this history arrow, this back arrow, and I can see the changes that have been made over time, not only within this assessment but across all assessments and visits. So if you want to find out what the patient's blood pressure was over time, if you come to the blood pressure question and you click this back arrow here, then you'll be able to see the history of the blood pressure for that patient over all visits and within the particular assessment. All right, so I'm going to click Next. It's going to allow me now to review the intake information that I had already put in. So let me choose, let's say that the patient is white. I click Next. I can modify the start of care date if I need to at this point. I can move it forward maybe a few days if necessary. I'm just going to go ahead and rifle through here. Choose a pharmacy. I'm just going to choose, most of these items are going to be the very basic that I can do. Temperature, you can choose from a list. And I'm going to just say NA for blood pressure and respiration. These all have lists and things that you can drop down as well, respiration and so forth. And then pulse, regular. I'm just going to choose NA for weight, height, and Medicare. Let me just skip over this. I think that will help me. Notice how when you choose particular items, it skips over it. So if I click if I search for 428, it automatically gives me that list, and I can choose whichever option is preferable. And I can say diagnoses. This is my actual M1020, M22 diagnoses that we just proposed, as opposed to my inpatient diagnosis. Let me add a second one just so I can show you how you would rearrange them if you needed to for whatever reason. Okay, if you're in the point of care, you're not a coder, you don't have to put the diagnosis in here. So if I want to clear this out and I don't really know what to say, maybe it's COPD. So I just type COPD in there. Or I can choose from a predefined list of common items from here. If I don't know what I'm looking for, I'm just a nurse who doesn't ever any coding. I just type whatever I want in there. But somebody in the back office is going to have to follow up then and change this to, or actually put in the code after the fact. All right. So now I've got my two diagnoses. If I want to rearrange them, I click Show All Columns, and that gives me the opportunity to move it up or down. So if I want to move this one up to be the top one, now that becomes the primary one. And then if I want to, later on, I decide, well, I want to code this after all. Or if I'm in the back office and I want to edit this so I can code it, I can just put it in there. You can either type the code in, or you can start typing in and it will zero in and for you on the description. Okay, let's go ahead and just quickly get through this. Choose whatever you want. You've got immunizations you put in. You can choose allergies, or you can type your own. Safety measures. Let's see, next. No, I'm a primary caregiver. Pain is organized from the top of your head to the bottom of your toe. So if you put in, you got a pain in the hand, you can say the date when it started. You put in the current and worst, least, type, and the intervention, other, and wake through, med frequencies, other types of things that you wish. Okay, a standardized test has been done. Yes, and indicates severe pain. Braden, I'm not going to do at this point, but that will score your. I'm just going to click next and through these as quickly as possible. Let's see now. So you can put in wounds here. I'm going to put in, let's say, pressure ulcer. Let's say left, right. Put in the height. Heal date. If you put a heal date in, it will not carry forward into the next visit. If you leave the heal date blank, then the items that will be carried into the next visit are the wound type and the location, and those will serve as prompts for you to document the actual attributes of that. So, and some of you have seen this before, so I'm just kind of going through this quickly. But you see there's a camera icon here, and you can choose to upload a photo. Sorry, I need to click browse first. If you're on an iPad, you can actually take a snapshot of the patient's wound while you're there and attach it directly. So I upload that, and so there's my wound that I'm attaching, and I can say OK, return, and that attaches that wound permanently to that, or that picture to that wound. And I can see that historically if I want as well. Inspirations. And I can choose the side. A lot of this is, additional information that's not necessarily part of the OASIS or part of the 45, but it allows you to capture all the systems for that patient. I'm just going to do this one. I'm not going to do the review mode, but you get the idea here. I'm just going to choose anyway.
230 must be you. So there are some, a number of real-time checks that are applied as you go through the system. There's also an LBQI available, a system that's available at the end when you're done. All right, moving through ADLs. Fall risk assessment, we've got the Mach 10. If you want to see that, you can, this is the new one that's applicable across the board that that's authorized for all agencies across the country to use. It's a fairly new one that we've thrown into the system for you. I'm just clicking no so I can skip past that. Okay, so we got the medications. Let's go ahead and add a new entry for medications. Let's call it Lasix. And then it automatically detects that's intravenous. We put a start date. And if I put a start date that's within 30 days prior to the cert start date, then it's going to put N on the 45 for new. Then I can choose quantity and 3 times a day. All right. If I put in a second one, then I can click on the check current patient drug interactions. I'm licensed as a user to do that. If you'd like to use that option, then you'll need to let us know how many workers or how many users would like to have that license. Again, you'll need to work that out with Randy in order to determine the license on that. All right, so we click next, and that was just one medication. I'm going to go ahead and check off the fact that I checked all these things regarding the medications. There's no adverse reactions. All right. This is a little bit tedious, but I do want to get through a whole entire assessment so that we can actually do the wrap. But this will give you a good opportunity to see what's available in the system. You can choose supplies if you want. Let's say the supply date is 17th or something like that. So if you're a clinician and you don't know what the therapy count is going to be, you can get past this question. We allow you to bypass the M2200 requirement. But if you know what it's going to be, you can go ahead and click yes, and then you choose however many visits and therapy visits you expect to be able to do for that episode. Now you will, if you skip that M2200 requirement, then the back office, they won't be able to validate or transmit or wrap that assessment until they actually, put that M2200 value in. Skin breakdown NA is going to cause me to skip over the nutritional deficit and skin questions. Okay, the Oasis C tracking sheet, I do recommend that you do this, and because it's going to allow you to track various events that happen so that you can see what happened to the patient over the course of the episode or the admission, so that when you answer those questions at the end in the final assessment, then you'll be able to know what has transpired for that patient. This is available in all of your daily visits. It's not just your start of care. Okay, this is an option that it's an optional thing. I'm not actually going to spend any time on it, but it's going to give you recommendations based on your ADLs and other questions in your assessment to say, okay, therapy visits. We recommend that you do OT for 2 times a week for 2 or 3 weeks and so forth based on our recommendations. But the actual orders that you actually are going to show on the 45 and that are going to drive your interventions for the episode, they're going to be in the next screen. So you're going to choose, for disciplines, you've got SN for your discipline, and you've got, you can put in frequencies, and it gives you automatically 1 time a week for 1 week. But you can put it, 3 times a week for 8 weeks here, and then maybe in the last week you're going to have 2 times a week for 1 week. So Monday, Wednesday, Friday, and then Tuesday, Thursday. Now, you can give, if your clinician, point-of-care clinician, if they have the scheduler role, then you're going to have all the scheduling information available for them to do. Otherwise, the only thing they're going to be able to do is put in the frequencies without putting the actual days of the visits and who's assigned to them. I'm just showing this to you for illustration purposes, but I can go ahead and assign this to Randy Drawn, and Randy Drawn again. And when I click Auto Create, then it's going to generate those scheduled visits on the calendar for me. All right, so if I want to see the calendar in more detail, I can click on here, and that shows me blue means that it's a visit that has already been put in the system or at least started. Green or red means it's a scheduled visit. Red meaning that it's in the past and is overdue. Green meaning it's either current or in the future. I can refine the schedule, and I can say, well, here's the start of care visit, but if I want to say, if I want to reassign to some other worker, like to Ken, I can do that, and I can say, beware of the dog, and that will show up on the worker's calendar, beware of the dog, because maybe Ken doesn't know that there's a dog there, whereas Randy did. So, also, you don't have to click save every time here. If you just click over on another tab, it's going to save it for you automatically. So if I went back here, I would see the change that I made for the dog. All right, so here, let's choose congestive heart failure as a problem to sort of categorize our visits. Our interventions and our goals. So I choose congestive heart failure, and if I go over to goals, I can say improve dyspneic episodes, and maybe interventions. I can come over here and choose assess vital signs. Now, there's 2 different ways that this can be done. We can set it up for you so that that it doesn't collapse this list every time. So this list stays open. So you click all the way down, and it will choose those. Will allow you to choose those items rapidly without having to have it roll back on you. We do provide the option the way it is right now, so that if you have limited space on your screen, that you can see things better. But we may just automatically set it up for you, so you just click without having to see the screen collapse every time. All right, so those are my interventions and my goals. So I can see that here's box 21 and here's box 22. Now, if I want to add a new discipline for PT, for example, I click new discipline, and I put in PT, and I choose frequencies, and new frequency set. Maybe I just want to do 1 time a week for 9 weeks. And we want to assign that to, you can say once a day or twice a day. I'm going to assign that on a Wednesday, or let's do a Thursday. And the worker assigned, let's say it's that worker. And notice here it says how many weeks there are on the cert period. There are 9. So I knew that I could put in 9 visits if I'm doing a weekly schedule. And Thursday is my last day, so I knew I could get away with putting Thursday because I saw this little yellow bracket at the end of the episode marking the last day of the episode. So if I click Auto Create, then it's going to put my PT visits on every Thursday for this particular work. And again, if I want to, if I chose in the disciplines, I chose PT, so everything I do along these tabs here is related to PT. So if I go to calendar, then I can see that I've got my PT visits. Notice here these indicators here. I've got 1, no eval, 2, no eval. This is how many PT visits have been done since the last eval. And so if you had put an eval in on this day, you would see 1, 0, because it's been 0 days since the last eval, and then the 1, 7, because it's been 7 days since the last eval, 1, 14, because it's been 14 days since the last eval. So this will allow you to track when the patient is coming due for a new eval. And this works across therapy, so if you have both PT and OT, it's going to count them up together. You can also receive alerts in your inbox, and I can show you that later, how you would receive alerts on your inbox to say when a patient is coming due for their 14th or 13th or 19th visit. Okay, and you can go into the refiner again, like I say, and you can reassign visits to a different worker. There's different ways you can do these visit reassignments. There's also the scheduling calendar that you can use. But let's go ahead and go over to problems now. And we're going to choose a PT problem. Maybe let's call this, I don't know, Dr. X knee replacement. We didn't assign a discipline, so it can be used for any discipline, really. But if we had assigned a discipline, you could still use it, but it would just show the discipline that's normally recommended. So Dr. X's knee replacement protocol. We're going to go over to goals, and one goal is to be able to play kickball, so we're going to say that. And one intervention is going to be take the patient to the gym. Now you can add, if you don't find what you're looking for in the list, you can just re-add it and then just click on here and it will bring it up, and you can just wipe that out and say whatever. And then press enter, and that will take you back to the list. So now you've got both of those interventions. So even if it's not in the standard list, you can always add one on the fly yourself. All right, so if I go over to my care plan and orders, then I can see now what it's shaping up to look like. I've got my interventions and goals for both skilled nursing and physical therapy. All right, so I'm done now with my care plan. Now I can also, at this point, if I'm ready, I can also document what I did in this visit. So I'm going to go ahead and say yes, and this will allow me to, I only had one SN goal for this visit, or intervention that I had put in. But if I try to move beyond this and don't document it, if I say, for example, progress towards goal is patient fair understanding, and I put in, some services provided or whatever, and I try to click next, it's going to say, you can't move on because, you have to put in whether you performed that or assessed that or instructed. And if you don't choose either one of those, then you got to say, well, maybe the patient wasn't ready, or whatever the reason was. You got to put a reason why you didn't do that. That allows you then in the back office to be able to be sure that anything that was ordered was actually performed, and if not, you have documentation as to why not. So if I choose this, if I clear this out and I choose performed, then I can move on. Either way. Boom it in flow sheet. I'm going to say no to that. And I think I'm pretty much at the end of my assessment now. Okay, so next. Okay, when you get to the end, you're going to just see a finish button there. And that's going to allow me to mark that assessment as having been completed so that I can then submit it to the back office. If I click cancel here, that's fine. I'm not going to lose any information. It's just that I'm going to have, I'm not going to have marked it as complete because maybe I want to come back and review it. But I can also click navigate at any point to jump back if I say, oh, okay, I remember I forgot to put in all my medications, for example. So you would find the medications in the list and you would jump to that. You can also expand to see various options within a particular group. If you click the plus sign, then you can see various individual questions belonging to that group. Now, if I had been lazy and I skipped over, if I used the navigate partway through the assessment and skipped over to the end and didn't answer all my questions, then the questions that I had not answered would show up in yellow. If I click expand all, then I would see a yellow highlight highlighting the questions that I have not yet answered. And if I have any yellow highlights anywhere in the list, then I'm not able to submit that to the back office. So it does prevent you from doing things that will make it harder for the back office to accept your work. So if I click Finish, it's going to do a double check and make sure everything has been complete before I can then submit it to the back office. If I want, I can click on OBQI to get a list of potential inconsistencies. I'm not going to take the time to do that right now. If I want to have the patient sign the visit that I just made, or either at the beginning or at the end of the visit, I can click on that patient's signature. If I have an iPad, then they can use their finger to go ahead and sign that. I'm going to save and return. So that patient signature is captured. If I want to put in any worker-incurred costs associated with this visit, I can do that by clicking on the dollar signs here. Put in new entry, and I can put in, miles driven. Maybe I put in, 50 miles or something like that. The other option you could do for mileage is you could put in a range. So if the odometer was at 94,385 and it went to 94,415 or something, then I can click Save and it will automatically give me 30 miles. And I've got it set up a particular mileage reimbursement rate in this database so that it comes out as $12.15. Now, if you have a particular rate that you charge per mile, then you would let us know and we'll help you put that in. So you've got also tollways and other types of things that you can capture. Now, if you want to see what the 45 looks like, printing this will print the entire comprehensive assessment. But if you're just interested in, well, what does the 45 look like? Well, you can click on View Docs, and that's going to give you a list of all the documents that have ever been created for the patient. And this patient only has one because we've only just done the start of care. But you can print either the start of care, the full comprehensive assessment, or you can print the 45, either one or the other, or both. So let's click the 45 and see what it looks like. So, it's a little sparse because we didn't put a whole lot of information in, but you kind of get the idea of what it looks like. Right? Now, at this point, what you can do, and it also generates automatically generates a suggested face-to-face encounter report that you can send off as well to the physician, but that's up to you whether you want to use that particular format or not. And if you sign up for the faxing service, then you can actually fax this off directly to the physician, even from the point of care. If you're really wanting to do that, you don't have to have a fax line. All you have to have is the internet. So if you click that, then it would automatically. Well, I don't see that. I guess the physician we put in, we didn't put a fax number in, so that's why there's no fax recipient there. But you can type the number in if you want. And then put in, please sign and return. Okay, I'm not going to go ahead and send it, but you get the idea. You can also attach, if you have photographs that you want to attach or documents you've scanned that you want to attach here, you can do that as well. Notice how we've also got this pen icon indicating that's the position of the patient's signature. Okay, so I can click return, and at this point I'm going to go ahead and submit this to the back office. And it's going to do some scrubbing, give me some inconsistencies. I'm just going to ignore those. I don't see any fatal ones, but if I needed to, I could go back and make corrections as needed. I'm going to just go ahead and click OK to have it submit. We have a couple other, warnings about, if some agencies want these warnings, some don't. If you don't want these warnings, we can leave them out. I didn't specify respiration or weight, just to give you an alert. These are just warnings; they're not errors. So I can go ahead and click Submit. the document was successfully submitted to the back office. So now I'm done with my OASIS/45. I'm going to click back, and so I'm still in point of care. And now, according to our agenda, we've added the OASIS start of care, and so now in the back office we're going to validate the start of care assessment. So I'm going to sign in now as Johnny Worker, J Worker, and I think that's the password I used. Yep. Okay. So let's go to clinical, and if I knew that one had just come in for that patient, for Johnny Medicare, then I could select Johnny Medicare and I could go and I could validate that. But if I'm working at a more workflow level and I want to know, well, what are the assessments out there that have come in that I still need to validate or do something to? So I click on Documents Owned by Office. And so I see here a list of recent assessments that have been turned in to me, to the back office, but have not yet been validated. It says assessments that have not been validated. If I want to see those that have been validated, I click this checkbox and I keep adding to the list by adding more and more options. But by default, this shows me the things that I really need to be focusing on at this point. Or if I want to zero in on a particular worker and see the particular documents that pertain to a certain worker, then I can do that as well. But here I see this Johnny Medicare assessment that has come in, so I'm going to go ahead and click on it. And if I wanted to, I could print this out using the print, and just to review it. It would print it on the screen, not literally to the printer. But if you did want to send it to the printer, you would also be able to do that as well. So the best way to review it is to click the print so that the whole thing shows on your screen at once. Now, if you did that and you reviewed it and you found there was a problem that you wanted the clinician, the point of care clinician, to be able to fix, then you would say owned by remote user, and then you could put in a message to say, please add all the meds immediately, something like that. And you could say urgent as well, and that will cause it to pop up on their screen the next time that they're in the system. So then when you click save and exit, it will transfer, it will send that assessment back to the point of care user so that they can then make changes to it, and they'll be notified as well. I'm not going to take the time to do that right now. I'm going to uncheck this. So I still own it. As long as I own it in the back office, then the point of care user cannot edit it anymore unless I return control to the point of care user using this owned by remote user option. All right, so at this point, the only thing preventing me from doing the wrap on this, I believe, is just I have to click validate for it to go through the Medicare checks. And it says, as a result of validating this assessment, the patient status has changed from pre-admit to admit. So as soon as you put in the first start of care assessment and you validate that assessment, then that patient status is going to automatically change from pre-admit to admit. So that's the distinction between pre-admit and admit, is that if you first put in a patient, they're automatically going to be defaulting to pre-admit. But until you've validated that first assessment, they're going to remain in pre-admit and change at that time. Okay, and those are my validation warnings again, but it didn't prevent it from actually validating. All right, let's go back here. Okay, so now we've got our main list of patients, and let me reselect Medicare and make sure that patient Johnny Medicare. While I'm still in clinical, I can see if the patient is clean and ready to go for claims processing. If I click on the billing integrity down in the financial section, there's a billing integrity button. This is going to scrub through. There's over 80 different checks depending on the type of episode it is and what the status is. It's going to run through a whole bunch of checks to make sure that there's nothing preventing the claim from being processed. Notice here these say warnings. Warnings are not going to prevent you from processing claims. They're just information that you might want to be aware of. Okay, So in my M2200, I see that I put in 14, whereas I only scheduled 9. I only put in 9 on my 485 for my frequencies. Okay, so this is sort of an indication to you that there's a potential problem. It's not going to prevent you from processing the claims, but it is something you want to be aware of. I can correct this. Perhaps the 45 is correct, but maybe I put the wrong thing in the M2200. So if I want to correct that, I can go back and I can go to my assessments and visits, and I can go documents owned by office, and there's my start of care because it's still owned by office. And if I go next, actually, one thing I didn't do, if I want to change any particular OASIS related questions, I'm going to have to first unvalidate that because it's going to lock down any MOO questions, any OASIS questions until I unvalidate them. So I'm going to go ahead and do that. It will allow me to change non-OASIS questions without unvalidating. To change OASIS, I would have to first unvalidate, which I just did. So I'm going to click Next, and I'm going to navigate. And that's going to be down in the M2200 area. Okay, so here I said yes. So let's put in 9 here to match with my 45. Right, I'm going to save and exit. Now I'm going to revalidate that. And return. Okay, let's go back and let's go back to patient info. And at the bottom here we've got billing integrity, so let's check that again. Okay, so notice before there were 2 warnings and now there's just 1. It means that it's telling me that I haven't checked the eligibility. It's just a warning. It's not going to prevent me from processing my claim, so I'm good to go. At this point, I'm going to just go home and I'm going to choose billing. And now somebody obviously who has not been assigned the billing role is not going to be able to get into here. But I gave myself the super user role, so that's why I'm able to get into here. So we're going to go into claims to be billed, and we're going to choose all dates. And we're going to see which claims are outstanding that haven't yet been processed. Well, the first time it's going to go a little bit slower because we haven't done this today all day. And so I've got a list of all of the claims that can potentially be billed. I've got my finals, and I've got my let's see, there's a lot of these. There's wraps, and there's also my my insurance claims that I could process if I wish. Right. So this is a list of all the claims or the episodes that haven't yet been processed, along with how many errors there are that are preventing them from going out. Let's see if we limit ourselves to the claim type of wraps. You can choose wraps, and that's going to just show the wraps. And hopefully we're going to see in the list, there's Johnny Medicare. Notice there's 0 errors and 1 warning. All right, so if I click on that, I can see the warning. Medicare eligibility has not been checked. There are others that I have for which I have multiple errors, like for this one, for example. There's no billable confirmed service journals. The service journal is basically our terminology for a visit or some billable item that typically a visit is what it's going to be. If you run into the situation where you see 1 or more errors that you need to correct, then if you click on that patient's name, that will take you into clinical, and then there will be a return button at the top of your clinical menu that will take you back to this list. All right, I'm going to uncheck these here, and I'm just going to focus in on Johnny Medicare. And when I do that, when I check that checkbox, it says, okay, well, here's a warning. Are you sure you want to go ahead and do this? And if I say yes, or I say okay, then it's going to go ahead and select that for me. I'm going to show all and just make sure I don't have any that I don't want to go out. I'm going to uncheck Johnny Darling, Johnny Murray.
Mendez, Appleton, Cassell. Let's just uncheck everything except for, well, I must have, Medicare, there it is, I unchecked that inadvertently. Okay, so I've got my one claim that I want to process, and you get the idea. You could select as many or as few of these as you wish. This is kind of a larger list, and so now I could, at this point, I could go ahead and click Submit Medicare Claims, and that would actually send it straight out to Medicare. Now, obviously, this is bogus information, so I'm not going to do that at this point, but what we're going to have you do, again, what I showed you in the administrative setup, you're going to put your NGS or Palmetto or whatever your intermediary is, you're going to put that password in the Medicare setup, so that then it will actually go directly out to your intermediary. All right, and basically that's all there is to claims processing for Medicare. There's somewhat more to do for non-Medicare, especially if you have authorizations that are involved, but I'm not going to cover that today. So I think that pretty much demonstrates all that I wanted to show for billing, with the exception of, if I go back here, I was in the claims to be billed. That's where I submitted those claims, or where I selected the claims to submit. But I can also go to my claim batch log, and that's going to give me a list of all of my batches that I've sent out over time. I can see here that this particular batch went out on 12/06, and there were 4 claims in it for a bill total of $11,200. And then I've got an attachment. I can always go back to my claims to see what the UB04 representation was of those, or the 1,500 as the case may be, of those claims. So those are the claims that I processed along with that particular batch. You can also click to see the detail of the claims that went out and see, these are the particular claims that were part of that batch, the patient's names, how much there were, how much was paid. Now the payments come in automatically for you if you, well, not for all payers, certainly for Medicare, and then there's certain other payers that you can receive the claim or the payments for automatically. But do you see this button here? It says refresh claim responses and payments from payers. That's going to allow you to once you submit claims, if you click that, it's going to refresh the results. So your 999 file is going to come back and say it was accepted or it was rejected or what have you. It's also going to pull in those electronic remittance advice payments for you. So in other words, what I'm saying is this is a direct connection to Medicare or to your payer. You're not really going to need to do the upload electronic remittance advice files unless you have a payer that doesn't participate in one of the clearinghouses that we support. We support primarily those payers that participate with Availity. But if you have your own payer that does not participate with Availity or Medicare, then you would maybe receive an electronic payment file from them, and then you can upload that file using this particular option here. There's also the remittance advice log, where you can see a list of the payments that have come in. So in this batch of in this remit, you can see there are 31 payments that have been received, and you can see the details of those and how much the net reimbursement was and so forth. Okay. The retrieve payer reports is going to give you a list of all the files that have come in, whether they be 999 files, remittance advice files. These are just the raw lists of files that have come in, and for the 999s, it's going to tell you whether it's accepted or rejected. 99.9% of the time, it's going to be accepted unless you did something like ignored the PICOS warning for a particular NPI number that you put in incorrectly. We do have, by the way, when you do validate an assessment that has, or try to do a RAP for a patient whose physician is not in the PICOS database, it'll warn you and let you know that they're not in the database. All right, so that's really all I had for this first session. Let's review anything else that the generator wrap for patient Johnny Medicare. One thing I did not mention when generating the wrap is if I go back to billing and I go back to claims to be billed, choose all dates, and then if I click on the show Medicare, show UB04 for Medicare, just a second here, to view Medicare claims, then it's going to pop up with a UB04 representation that you can then review prior to actually clicking the submit button. So you can just look through that and satisfy yourself that it looks correct before clicking the submit Medicare claims. So really all you need to do is select the claims that you want from this list, then click the submit Medicare claim, or review any of the ones that you want to do through these two buttons here, and then click submit Medicare claims, and then you're done. All right, I guess that's it for this session. Let me see if there's somebody is saying they can't hear the speaker. Sorry, I haven't been paying too good of attention. I'm so preoccupied with giving the demonstration. I'm sending a message to the person who said they can't hear me, and I'm not sure if they can hear me at this point or not. At this point, feel free to put in the chat window any questions you might have. Okay, so I'm interacting with one of the, okay, somebody can hear me. I don't know how many were not able to hear me and at what point. If the person or persons who were not able to hear me for some time could let me know at what point in the process they could not hear me. Presumably, since some of you are saying you could hear me, that it's not a general problem. So perhaps it was specific to that one listener, and maybe what we'll do is when we generate the video file as a recap of what we've done here, we'll post it online for everybody to review, and hopefully the sound will be available to those who were not able to hear portions of it up to this point. All right, well, I'm seeing that most people are responding that they can hear me, so I'm hoping that was just a single issue or a single person who's having that issue. But feel free, anybody, to type in the console to have any last-minute questions that you want me to focus on. Otherwise, you can send, again, like I mentioned earlier, an email to ken@goldenrulesoftware.com, or perhaps even better, because if I'm not available, it would be best to use support@goldenrulesoftware.com, and then I will get back to you as soon as I'm able, or whoever is available at the time will be able to get back to you. All right, I'm going to close by focusing in on one other housekeeping item that's very important, and that is creating a help desk account. The primary way that we find it's best to interface with our customers is through the help desk system. So you would create a ticket, and then we typically, somebody's always monitoring the help desk. And so if I'm on the phone and you send a help desk ticket, then one of my coworkers is going to see that and give you a call right back. Or else, if it's a simple thing that can be done over the internet, we'll just send you a response saying, okay, you click this button, you do that, and that's how you do this. So oftentimes we'll receive questions about, well, how do I do this, or how do I do that? If you're in a situation like that, feel free to submit a help desk ticket and explain to us in detail what it is you were trying to do, and give us the name of the patient that you were trying to do it for, rather than giving us a general statement about, well, I can't enter a visit. Well, who was the patient that you were trying to enter the visit for? What was the date of the visit? What kind of visit were you trying to put in? What happened when you did it? Those types of details, if you give them to us, then we can research that and figure out maybe what the problem is, and then before we get back to you, and then we're not having to go back and forth so much. Let me just show you here how you would create a help desk account. If I sign out and I go back to the login page, there's a link here called, it says Golden Rule Software Incorporated. If you click that link, and you'll see there's a help desk. This is our home page for our company, and you'll see there's a help desk link. If you click on that, it'll take you to the help desk, and on the right hand side there's a become a new user. You click become a new user, you put in your name, your email address, your telephone number, whatever password you want to use that's at least 6 characters in length. Now this is not the same as the username and password necessarily that you would have in CarePortal itself. This is an entirely different system. This is just for the help desk. So you put your information in here, put your company name in. The rest of the information is pretty much optional. You click register, and then when you're done, you should be able to then log into the help desk. I would recommend once you're into the help desk, right-clicking and clicking Create Shortcut so that you have that shortcut on your desktop so that you can bring that up at any point in time and then create a new help desk ticket. And then we will automatically receive a message whenever you do that, and we'll get right back to you. The main reason we prefer to use the help desk is because then things don't fall through the cracks. We have a written record of every request, and we're able to track everything through to completion. And we are very, very responsive to these help desk tickets. You can ask any of our customers and they'll tell you. All right, so let's go ahead and sometimes if the only response might be, hey, we're busy right now, we'll get back to you as soon as we're able in the next hour or two or whatever it might be. But at least you know that we're paying attention to you. All right, so let's go ahead and close out our session unless there were any other questions that came in. I guess I don't see any questions. And so I'm going to go ahead and end this session, and I very much appreciate everybody attending, and I do apologize for the technical difficulties where some people were not able to see the screen, and then there was a timing issue where we got started. There was confusion over the start time, but I appreciate you bearing with me, and I wish you all a very merry holiday season, and we'll be back in touch. I guess Randy will be in touch with you regarding the next session. Again, we focused primarily on Medicare today, but the next session we'll take a look at some of the ins and outs of non-Medicare managed care processing. All right, thank you all again very much. Appreciate it.